Hi, my name is Pauline Isabel A. Centeno from SN2A, and today I will demonstrating the head, eyes, and ears and nose assessment. So, for this assessment, the materials needed are the pen light, tuning fork, gloves, otoscope, cotton swab, notepad and pen, Snell and chart, and the newspaper. For assessment, we need to identify the client. We can ask the name of the client. Mom, what is your name?
This is Hygiene.
Okay, Mom, thank you. This is to avoid medical errors and to confirm if the procedure is appropriate to the client. So next is we need to explain and discuss how can she cooperate. So Mom, today I will assess your head, eyes, ears, and nose. So all you need to do is to follow my instructions. Is it clear, Mom?
Stop.
Okay, Mom. Thank you. So this to lessen the anxiety and gain the cooperation of the patient. So this is to assess the body easily. So we need to plan. So we need to perform hand hygiene. This to avoid the transmission of microorganisms to prevent illnesses. So we can wash our hands and put alcohol in our hands. So next one is to provide privacy. So we can close the doors and curtains to provide respect to the client and enhance autonomy, prevent economic harm, embarrassment, and discrimination. So this also to avoid distractions from external noises. So remember, before implementation, we need to put our gloves to avoid transmission of infections if there is an open wound from the client. But for this demonstration, I will not put gloves so we can palpate nodules and muscles easily. So for implementation of head, so we need to palpate the skull for the size, shape, and symmetry. And I palpate the skull of the patient. So as we can see, the shape of the skull is round or normocephalic. So as we palpate, the skull is also smooth surface. If we observe any flattening of the skull of the patient to the right side or to the left side, so we can consider it abnormal. So we can look also for evidence of macrocephaly or enlargement of skull, and microcephaly for if the skull is smaller than normal. So there is evidence of longer mandible, head, and nose due to excessive growth of hormone is considered abnormal. So as we can see, so the patient has normal size, shape, and symmetry of the skull. So next one is we need to palpate for nodules, masses, and depressions. So we will now palpate the skull of the patient. So as we palpate the skull, I don't feel any nodules or abnormal growth of tissue. There is no masses. There is no sebaceous cyst. There is no deformities due to trauma, and I don't feel any dents in the skull. So we can consider it normal. So next one is we need to inspect for facial features, symmetry, structures, distributions of hair, and facial movements. So as we observe, the client possesses a normal skin color of the face. The face is normal. to the body size. The eyes and ears are in the same level, so right, at the same level, so there is no evidence of drooping of face like this one. There is no evidence of twitching or abnormal movements, and there is no thinning of hair, so this is not of the patient. So to further check the facial movements, we need to test the cranial nerve. So we can ask the client to repeat after me. So, Mom, can you do the same thing I'm doing in my face? Is that okay, Mom? Okay. So just repeat after me, okay, Mom? So please elevate both of your eyebrows like this one. Okay, Mom? So roll or lower your eyebrows like this one. Okay. So next one is, you will close your eyes tightly. Okay, Mom? So please pop your cheeks. Okay, Mom? So smile, Mom, and show your teeth. Okay, thank you, Mom. So may I ask if you feel any pain after doing that facial movements? Okay, Mom, thank you. So we can tell that the cranial is intact because the patient don't feel any pain during the facial movements. So next one is, we will now inspect the eyes for edema and hollowness. So we will ask the client to face upward like this one, to see if there is an accumulation of fluid under the eyes. So as we observe, there is no presence of edema, so there is no evidence of exophthalmos or bulging of eyes, so there is no evidence of enophthalmos or sunken of eyes, and there is no evidence of periorbital edema. So we can say that the patient is normal. So next one, we will now assess the eyes of the patient. So in eyebrows, inspect the evenness of the hair distribution and symmetry, skin quality, and movements. So as we observe, there is no uneven hair distribution of eyebrows. So the skin is intact. The eyebrows are also aligned. So you can ask the patient to move your eyebrows. Mom, can you move your eyebrows, please? Okay. Okay, Mom. Again, Mom, another one. Upward. Okay. Okay, Mom. Thank you. So as we can see, there is an equal movements of eyebrows, and we also observe that there is no evidence of scaling and unequal movements of eyebrows of the patient, so it is normal. So next one is, we need to assess the eyelashes. We will now inspect the eyelashes, evenness of hair distribution, and direction of curl. So as we can see, the eyelashes evenly distributed and curled outward, not inward. If the eyelashes of the patient curled inward, so it is abnormal. So next one is, we will now assess the eyelids of the patient. So we will now inspect for the surface characteristics, the position in relation to cornea, ability to blink, and frequency in blinking. So we will now observe the eyelids of the patient as well. So, as we can see, the skin of eyelid is intact. There is no discharge. There is no discoloration or redness, jaundice, and paleness of the skin. So, we can ask the client to close her eyes. So, mom, can you close your eyes? Okay, as we can see, the lids are closed symmetrically. Okay, mom, thank you. Please open your eyes. So next one, using our watch, we will now count the numbers of blinking of the client. So we will now count it for the whole 1 minute. Okay, so after 1 minute, the client have 17 blinking, so we can consider it normal. So we can ask the client if she feel any pain upon blinking. So mom, do you feel any pain upon blinking? So okay mom, thank you. So there is no evidence of ectropion and entropion or bulging and sunken of eyelids, and so we can consider it normal. So next one, we will now proceed in inspecting for bulbar conjunctiva, for color, texture, and presence of lesions. So we will now ask the client to look upward. We will now pull down the eyelids. As we observe, there is no evidence of jaundice, pallor, and erythema. So there is no also lesions present in nodules. So it is normal. So next one, we will now inspect the palpebral conjunctiva for color, texture, and presence of lesions. So in this one, the first thing to do is to close the eyes or the eyelids of the patient. So mom, please close your eyes. Okay mom. So after closing the eyes of the patient, we will now use a cotton swab to depress the mid portion, the eye, and lift the lashes forward. So as we observe, so it is smooth, shiny, and pink in color. So there is no also evidence of redness, remissions, and nodules. So next one, we will now, so the same thing, we will now so it is normal, so It is pink in color, the palpebral, so there is no masses and it is also smooth. So after that, we will now inspect and palpate for lacrimal gland. So we will now palpate the lacrimal gland. Palpate the upper corner of the eye below the eyebrows of the patient. As we palpate, I don't feel any tenderness and no swelling of lacrimal gland. So it is normal. Next one, we will now inspect and palpate lacrimal sac and nasal lacrimal sac. So we will now palpate from the mid portion of the eye, lower to the nose, where nasal lacrimal duct is placed. As we palpate, there is no evidence of edema, and the client doesn't tear up when we press it. So it is normal. So next one, we will now assess the cornea of the patient. So we will now inspect the cornea for clarity and texture. So as we can see, it is transparent, shiny and smooth. The iris is also visible, and there is no arcus nasalis or the grayish white ring, which is normal to the old people. So next one, we will now perform corneal sensitivity test. So of the fifth cranial nerve. So using our cotton buds or cotton swab, we will now brush the lower portion. So as you can see, the client responds is by blinking of her eyes. So let's do the other eye. We'll now brush the lower portion of the cornea. So the client blinks, so it is normal. So we can say that trigeminal nerve of the patient is intact. So we will now inspect the anterior chamber for transparency and depth. So as we can see, there is no shadows right in the iris, and the depth is 3 millimeters. There is no evidence of cloudy iris, which is normal. So next one, for pupil inspection, we will now inspect pupils for color, shape, symmetry, and sizes. So as you can see, the client possesses black color of iris, so it is normal. It is equal size in both sides, and the iris is flat and round. So, and there is no presence of anisocoria or the right and left pupil is unequal. So there is no bulging of iris towards the center. So next one, we will now assess each pupil for light reaction. So we will now hold our pen light. So we will now light one at a time. So the pupil is observed constriction and dilation. So when illuminated, so the client pupil is constricted. So when not illuminated, it goes back to the original size. So next, on the other side, the eye. So it is normal. There is no evidence of unequal response between the two pupils. So we can consider it again normal. So next one is, we will now assess extraocular muscles. So we will now assess 6 ocular movements to determine the alignment and coordination. So, Mom, all you need to do is to follow my pen light. Is it okay? So, just your eyes only. Okay, Mom. Thank you. So, we will now move our pen in the middle, in the medial rectus, to the lateral rectus. So, medial rectus again, to the lateral rectus. So, back to the medial rectus. So, next one, we will now put our upright, down left. So, half left, down and down right. So, as we observe the client, both eyes are coordinated and have unison in movement. So, there is no signs of strabismus in a condition where one side of the eye failed to follow the pen. So, next one, we will now perform eye cover test. So we will now ask the client to cover her one eye with a cord. We will now look straight now. So okay, Mom. So observe the eyes of the patient. So it must not move. So as we observe, the client eyes is at a fixed point. So, Mom, can you remove the cover of another eye? So, okay, Mom, thank you. So, as the patient remove the cover, so her eyes must be aligned at the fixed point only. So, it is normal. So, the abnormal findings for this one is if the eyes move, so that indicates problem in eye alignment. So, next one is we need to assess the visual acuity. So, we will now test for near and distance vision. So, for near vision, we will ask the client to read this paper 14 inches away from her. So, there is anything that a huge space that has less. Okay, Mom, thank you. So, as we observe, the patient able to read. So, her near vision is normal. So, we will now. Can you read this one again, Mom?
The following belongs to the different states of mixture except.
Okay, Mom. Thank you. So, as we can see, the left and the right eye of the patient has a normal near vision. So, next one is we will now assess for vision. So, for the distant vision. So, we will now ask Snellen chart. So, we will now ask the client her one eye 20 feet away from our Snellen chart. So, we will now let the client read small to big letter.
A, C, A, B, Z.
Okay, Mom. Thank you, Mom. The other eye, please. Cover your other eye. So, okay, Mom. Please read again.
Z, F, D, E, F.
So, thank you, Mom. So, as we observe, the client read effectively 20 feet away. So she has a 20/20 vision. So ma'am, thank you. Can you see? Which is a normal finding. So next one, we will now assess the visual field. So we will now assess peripheral visual fields. So we will now ask the client to cover one of her eyes. We will do the signs in the peripheral side. So mom, just tell me what number my hands are making. So okay mom. Okay mom. So 3. Okay, thank you mom, thank you. And the other eye please. So tell me again what the number that my hands are making.
3, 4, 5.
Okay ma'am, thank you. As you can see, the patient able to see my fingers in peripheral vision. So we will now conclude that the patient has a normal peripheral vision. So we will now proceed in assessing the ears. So in assessing the ears, we will now assess auricles. We will now inspect for color, symmetry, size, and position. So upon inspecting the right and the left auricle, so the color is the same in the client's skin color. So as we draw a line, the eyes and the ears are in symmetric position. So there is no signs of discoloration, redness. There is no evidence of low set ears when we do the angle measure. So the client has less than 10 degrees angle, so it is normal. So if you find that the angle of the ears is greater than 10 degrees like this one, or have a low set ears, it indicates abnormal, it indicates Down syndrome. So next one, we will now palpate for the texture, elasticity, and areas of tenderness. So we will now pull the auricle up and down when the client is about 3 years old, and down and back if the client is less than 3 years old. So we will now pull up and down. So on the left ear, up and down. So it has a normal elasticity. So next one, we will now pinna forward and should be recoiled. So okay, to the other side, pull the pinna. So it is recoiled. So push the tragus of the ears. The next ear. Okay, so after that, we will now apply pressure to the mastoid process. So as we apply pressure in mastoid process, we don't feel any masses present, so it is normal. So the auricle, mobile and tender as we observe. So there is no lesions and scaly skin that indicates dehydration. And so after that, we will inspect the ear canal. So using our otoscope, so since we don't have otoscope here, we will just use our penknife. We will inspect the cerumen, skin lesions, pus and blood. So as we can see, we don't see any lesions. So the patient has a dry cerumen. There is no also redness and discharge. So on the other side, there is an also dry cerumen. There is no discoloration and there is no discharge. So next one, we will now assessing hearing acuity test. So we will now assess the client response to normal voice. So, Mom, can you hear me? Okay, Mom. So you must repeat the words I say. Is that okay? Apple, train, folder. Okay, Mom. Thank you. So as we observe, the client hear the voice clearly and repeat the words effectively. So next one, we will now assess the client response in whispered voice. So we will now stand 2 feet away and position the client where she can see us. So Mom, can you occlude the one ear by putting the client's finger? So we will now whisper non-consecutive number as a client to repeat it. So Mom can just repeat the number I will say, okay? So 43, 24, 100. Okay, Mom. To the other side. Occlude the ears. So I will whisper again another numbers and just repeat what will I say. So 72, 84, 84, 12. So as we observe, the client able to repeat the numbers properly, which is normal. So next one, we will now perform watch take test. So we will now place 3 centimeters away from non-occluded ears of our watch. Can you, Mom, occlude? Did you hear the ticking sound, Mom?
Yes.
Okay, Mom. So the other side, Mom. So did you still hear the sound?
Yes.
Okay, Mom. Thank you. So as we observe, the client able to hear the tickling sound, which is normal. So next one, we will now perform Weber's test to assess the bone conduction. So we will now use the tuning fork. We will now place the tuning fork in the client's scalp. You will just pound it. So, Mom, did you hear any sound?
Yes.
Okay, Mom. So, thank you, Mom. So, the normal findings in this one is the patient able to hear the sound that indicates reverse positive. So, the abnormal findings for this one is when the sound is heard better in impaired ear. So, as we observe, the client able to hear the sound equally. So next one is we will now perform Rhine's test or Rhine's test to compare ear conduction. To do this, we will now use the tuning fork. So we will now ask the client to raise the hand if you don't hear the sound. Okay, Mom? We will pound the tuning fork to the mastoid process at the back of the ear to test the bone conduction. Again. Okay, mom. Please raise your hand if you don't hear the sound. Okay, mom. So next one. Count again the tuning fork. And we will place it 3 centimeters away from the ears or in front of the ears of the client to test the air conduction. So raise your hand if you don't hear any sound. Okay. Thank you. So we will do the same thing on the other side. So raise a hand if you don't hear the sound. Thank you. So in front of the ear, so raise your hand if you don't hear the sound. Okay, mom. So thank you, mom, for this operation. So where did you hear the sound better? Okay, mom. Thank you. So in front of the ear. So noted po. So the normal findings are when the air conduction is louder than the bone conduction, or the patient able to hear more sound in front of the ear than at the back of the ear. So we will now proceed in nose assessment. We will now inspect external nose for any deviations in shape, size, or color, and flaring, or discharge from nares or nurse. So as we observe, so there is unsymmetric straight nose, so it is balanced in both sides. There is no also discharge, and there is no uniform color of the nose. So there is no also discharge from nares as we use our pen light. So there is no localized areas with redness, so it is normal. There is no presence of skin lesions around the nose. So next one, we will now inspect the nasal cavity for redness, swelling, growth, and discharge using our pen light. So the mucosa is pink on both sides, and there is no discharge, and there is no also lesions present. So it is normal. So next one, we will now inspect the nasal septum between the nasal chambers and noting its position. So the nasal septum is like a bone between the nasal chambers, or this one. So after we inspect it and palpate, so it is intact and it is in the middle line. So it is normal. So next one, we will now palpate any tenderness, masses, and displacement of bone and cartilages. So we will now press in the frontal sinuses from under the cranial lobes. We must now take note. Avoid putting pressure in the eyes. So we will now press upon the maxillary sinuses under the bony cheeks. We will inspect and palpate, but there is no tenderness and lesions. So lastly, we will locate, palpate, and identify sinuses and note for any tenderness. So We will now start palpating frontal sinuses. So, F1. So, in the maxillary sinus, so as we palpate, we don't observe any tenderness, so it is normal. For evaluation, we evaluate if the findings from physical assessment is within the normal range, and it is to determine if the client or the nursing orders need to change or completed. So lastly, we need to documentation. So we will document our significant findings and report other findings in our notepad. It is to provide accurate reflection for nursing assessment and to record information that can help to support proper treatment of the client. So always remember that everything is not documented is considered undone. So, yun po.